morning, Willie.
About 20 million Americans taking these PPIs, among them Nexium, Prilosec, Prevacid. These are familiar drugs. Explain a little more what they found in this study.
Well, first of all, Willie, we have to say that the study researchers used a rather unconventional approach to studying big data and also to look for a particular drug effect. What they did was scan and analyze the medical records of close to 3 million patients and tried to link together sort of code words or keywords such as heart disease, heart attack, and these drugs called PPIs. And what they found was that there was a 16 to 20% increased risk of heart attack in the people who were using these drugs called PPIs. These were their study conclusions and association, not a cause and effect.
So some experts, and it sounds like we should include you in this list, are a little bit skeptical, at least of the methodology here.
Correct. And I think, we have to remember that the traditional approach, the approach that the FDA sort of would support, was that you do something called a prospective randomized control trial. That is, you take a study drug and you compare it to a placebo. You have two groups and you very specifically look for an outcome measure to determine whether or not a drug is causing a particular effect. The study authors are very clear that their study is not suggesting that there is a cause and effect. Rather, they're raising the suspicion or concern that there is potentially an association between these drugs.
The same study looked at a different type of antacid called H2 blockers. This is Zantac and Tagamet as examples. Was there any concern about these?
There wasn't, which would sort of lend a little bit of support to their findings that patients who were on these other H2 blockers, there was not this effect. So that was one, sort of plus for them, I should say.
So bottom line, should anybody be concerned with taking these drugs?
No, I think this is one of those times where we definitely have to say you need to speak with your physician about whether or not you need to be taking these drugs indefinitely. What we find a lot is that patients who are taking prescription medicines like this, doctors keep refilling the prescriptions, refilling the prescriptions, and perhaps these people should not be taking them for such chronic long periods of time. So you need to discuss with your doctor.
Good information, Dr. Natalie Azar. Always good to see you. By the way, we reached out to the makers of these drugs who reiterated that the safety of proton pump inhibitors, PPIs, were extensively reviewed by the FDA before approval, and they have an important health benefit to consumers who suffer from heartburn. Savannah?
All right, Willie, thank you so much.